Hey, what's going on, guys, and welcome back to another video of Keep It Simple Stupid. And today we will just be discussing the types or the classification of different pulmonary emboli made simple. All right, guys, let's go ahead and get into it. And just a little refresher here. If you don't remember what a pulmonary embolism is, we're not going to get into that in great detail in this video. Just think of a pulmonary embolism as a blood clot that travels up through the venous system, through the heart, into the pulmonary arteries. So if you think of this, here's a blood clot. Right here in purple, say it maybe originated in the lower extremities, it travels up through the right side of the heart. And then after going from the right atrium, right ventricle, it goes up into the pulmonary vasculature and causes some pulmonary infarcts. So again, big picture, pulmonary embolism, blood clot, lungs. When discussing pulmonary embolism, there are three categories that it can be grouped into, and they range from low risk to high risk. So let's go ahead and discuss really quickly what these are. So first one is high risk. This is going to be the most dangerous. And then in your hospital, you may also hear the term massive. Okay, so a high risk is a massive P. Now just know that these terms massive and submassive, they don't actually refer to the size of the actual embolism. They refer more to the hemodynamic effects that are caused by the embolus, but I'll discuss that a little later. So just remember, the most dangerous is high risk, also called a massive. 2 is going to be your intermediate risk, or your submassive, and then 3 is the one we care the least about, or is the least life-threatening, and that's going to be your low risk. The next question is, what exactly do you need to see in a patient's workup that can let you know what category a pulmonary embolism falls into? So here are the things we need to know, is that the categorization will be based on 2 things. One is going to be the patient's hemodynamic instability, and then 2 is going to be the presence of right ventricular dysfunction. Now let me go ahead and break that down in a little more detail. Now let's go to our first example, a high-risk pulmonary embolism. Okay, so how do we diagnose that? So with this one, since it's the most life-threatening, this is kind of obvious, but you're going to see hemodynamic instability. Okay, and what that is defined is a systolic blood pressure less than 90 for 15 minutes not caused by a dysrhythmia or other etiology. Pretty straightforward there. So think pulmonary embolism, systolic less than 90, you're most likely looking at a high risk, aka a massive PE. All right, now let's go ahead and move into the intermediate risk, aka the submassive pulmonary embolism. So with this one, you will be hemodynamically stable. Right, so blood pressure should be pretty good, but then you will either have an elevated troponin, or you will have evidence on an echo or a cardiac ultrasound of right ventricular dysfunction. But another laboratory study you may want to check as well is going to be a BNP. We've gone through high risk and intermediate risk. This is going to be our low risk pulmonary embolism. These patients, they're going to be hemodynamically stable, and then they will have no evidence of right ventricular dysfunction. For the last component here, we're just going to discuss the treatment. Now for this talk, I'm not really going to get into the specifics about the treatment options, but I'll just very briefly cover it. So for a low risk, so our least deadly pulmonary embolism, the treatment's going to be a DOAC, which is just direct acting oral anticoagulation, outpatient. Generally, I've seen Eliquis, but there could be other agents you pick based on the patient. Now, your intermediate risk, where we're getting a little more dangerous here. So there's a couple options. Generally, you can start a heparin bolus and infusion. And I say plus minus thrombectomy over here. So this may depend on your institution. There's interventional radiology, or sometimes cardiology will actually do this. We'll look at the imaging and kind of make that distinction. Okay, is that clot big enough that I can pull it out? Now that's a decision, again, an interventional radiologist or a cardiologist is going to make, not something you would make on the medicine floor or as an emergency medicine provider. Because obviously you're not going to be doing that. That's going to go to the specialist. And then finally, the high risk here, right? Pretty straightforward. So if you got a patient, you got a high suspicion for a PE and they're in cardiac arrest, I mean, generally, you can think thrombolysis like pushing TPA, like systemic anticoagulation, kind of like a Hail Mary throw. And then also with the high risk, if you got a PE so big that it's making some blood pressure low, then generally there's probably going to be patients that would get a thrombectomy. But in the case, for whatever reason, it's decided that they're not a good candidate for it, that is definitely going to be anticoagulation, heparin, bolus infusion, admit to generally the ICU. All right, well, that's all I have for you guys today. I hope this little video was helpful and kind of helping break down the different classifications for pulmonary embolism. Thank you guys, and as always, like, comment, subscribe, and if you would like me to make another specific video or a specific topic, feel free to let me know. Thanks guys, see you next time.